Yo, what's up guys? In this video, we're going to be looking at the hip and ways to recover from hip injuries. So let's get started.
So the hip is a ball and socket joint, and you can see that it's held in here by a lot of tendons, and muscles also help with the stabilization of the hip. This is the front part of the hip. You see how it's attached to the pelvis, and then this is the back or the posterior of the hip. Two of the most important, strongest muscles in the body are the gluteus maximus, which sits up here, and then the medius, which sits on the side. And anytime you see some like ridges or things like that along the bone, you know that's where the muscles attach. So the gluteus maximus attaches down in this area of the femur, and the gluteus medius, which is a very important muscle for abduction, attaches out here on a bony tubercle called greater trochanter of the hip. So as I said, there's a lot of muscles that come down here and cross over into the leg area to allow you to do a lot of movement. And there's also a good deal of blood supply to your femoral artery that runs down through here, this area of your hip, and then good amount of nerves, one chief nerve being the sciatic nerve that runs the posterior part of your hip here. It runs off of your back down here at the lower levels, L3, L4, and then crosses on the back of your leg and runs down pretty close to the lateral biceps femoris muscle of your leg. So besides the tendons created by the muscles, the ligaments, which are surrounding the ball and socket to keep it in there, you also have your bursa, which serve as like fluid sacs to get rid of friction or to help when you move your leg for it to be a little bit more smoother, that go in and over top of the bones. So there's one chief one that goes over the greater trochanter, and it's right in this area here. And a lot of times when people say, oh, you have hip bursitis, that's usually what it is. It's some inflammation of the bursitis of the greater trochanter. So the hip does a lot of different movements, and I'm just going to go over them right now with Chris. The first movement that the hip does is hip flexion. So all the muscles that are in the front or the anterior part of the hip help out with hip flexion. And this is hip flexion, just like this when he raises his leg up. Raise your leg up, Chris. Just like that. So all the hip flexors right now are working in Chris's leg, and they're on the front part of his hip. When you move your leg out to the side, that's hip abduction. And that's the gluteus medius muscle. One of the mistakes people make when they do this exercise or do this movement on the table is that they rotate their back in this direction, and that works a little bit of the hip flexors as well. So when you're doing hip abduction, you really have to make sure that you're on your side, and this is kind of level, and then you just go up and down in that manner. So that's hip abduction. Hip adduction is achieved by working the muscles on the inside of your leg. Chris is going to raise his leg here. And then the hip extension motion is done by the gluteus maximus, which is the strongest muscle in your body. And we talked about where its origin was and its insertion was. That's hip extension right there, raising his leg like that. The hip also does three other movements. It does hip external rotation, which is the movement you do when you go to put your shoe on, like this. And most people have about 45 degrees of external rotation. And then hip internal rotation. A lot of times when you're getting in and out of a car or in and out of a booth at a restaurant, you'll do hip internal rotation. And then the final movement is with your legs straight, you know, rotation or circumduction. And that just rotates the ball in the socket of the hip. Hip pain is associated or comes along with muscle weakness in the hip in a certain area. So we're going to talk about that now. First test I'm going to show you is the Thomas test, and it tests for hip flexor tightness, maybe something going on in the hip labrum, which is around the socket of the hip, or just some capsular stuff. You're going to lay in a position like this or have the patient lay in a position like this, and then Chris is going to keep his back completely flat and bring one knee up towards his chest and then pull that in with his hand. What we're going to look at is raising of the opposite leg here as he's pulling this leg in. And if this is real tight, meaning it's going to come up off the table a lot, and he's going to get some some symptoms here in his leg, in the hip area, then we know that he has a very tight hip flexor. The real thing to do is compare the left one to the right one and see if there's a difference there. And so, for instance, if Chris had a very tight hip flexor, and if he was having symptoms in the front of his hips here, he could do this exercise by pulling this in, getting to the end of the table, and stretching out that left hip flexor. And that might make him feel better for the symptoms that he's having. The next test I'm going to show you is called the Faber test. It's actually an acronym for flexion, abduction, external rotation. This test is a test for capsular tightness as well. You know, Chris might have been doing a lot of activity. Maybe the front of his groin area is hurting. We'll see if we can reproduce the symptoms and tightness with this. So you want to keep this part of the hip down and just sort of see how far off the table the opposite leg is, the leg that's up on the other leg. And then you switch it up, compare left to right. Again, keeping the hip down over here. And so say, for instance, if this one's way up in the air, there's a lot of room between the table and the hip, and he's getting some symptoms here, then he probably has right hip capsular tightness. The way you can stretch that out, you would get in this position here after doing the Faber test, and maybe this leg is a little bit higher than this leg, and so gently push down on this leg, try to stretch out that area that we just talked about. As we get older, a lot of people get osteoarthritis in their hip area. This test is also a good test for gluteal tendonitis, or some of the muscles that are on the outside or around the hip here. But what you're going to do in this case is you're going to bring one leg up straight like this, and you're going to move the foot out towards you. And this is internal rotation. I'm going to tell Chris to hold his leg here, and I'm going to try to push his foot towards that way, towards his body. Okay, and he's fairly strong and he's not getting any symptoms with that. So we talked earlier about greater trochanteric bursitis of the hip, and that usually happens in this area here. And the gluteus medius attaches in this area here. Palpation always isn't a good indicator of exactly what's going on, but in this instance, it's usually pretty good. So if I get in there like this and I go over that bony area, and that's real painful, that may be an indicator of hip bursitis. Also at nighttime, if you sleep and you bring your leg down in this motion like this, that sort of pulls on that area there too. And that might be another indicator of hip bursitis. So if your hip's bothering you, a lot of times your gait pattern is going to change. You're not going to take as long of a stride. You'll just see some differences in your gait. One of the key differences that we see here with somebody who has hip abduction weakness is what's called a Trendelenburg gait. I'm going to demonstrate that to you right now. One of the ways we correct that initially is by having somebody hold a cane. This cane's a little bit low for me, on the left side. So I'm going to hold the cane in my left hand, so when I step, it keeps my pelvis level in the back. At the gym, you can use something called a multi-hip machine. Now the multi-hip machine works abduction, adduction, hip flexion, and hip extension. And he wants to keep his foot facing forward. And you don't have to use a lot of weight with that to start. And again, you're going against gravity, so it's a lighter weight that you're going to use, and you may notice a difference between your involved leg from your uninvolved leg. And you want to keep your pelvis kind of stable and just move your hip in that direction. And these are the muscles that help get you out of a chair and also get you up and down steps. If you're going to your local gyms, most of them have a hip adduction machine. You can work both of your hips at the same time. Start with a lighter weight. Bring your legs out, not too far to start with, and then squeeze them together. And as I said before, you can kind of see if you feel a difference between your involved leg and your uninvolved leg. Start out with lower weight, higher reps. Try not to do anything to irritate the leg. Start with higher reps, lower weight, and try not to irritate your leg. If you feel that it's giving you some pain, I would back off on it. Push the sled back in that direction. You don't want to fully extend your knees, so you don't want to feel it a lot in your knee joints or in your hip joints, but you do want to feel it working your glutes and your quadriceps. So let's just say you're an athlete or you want to get back into athletics and you no longer have any pain with active range of motion. You're sleeping without any problem. When you're moving around during the day, you're not having any pain, but you want to get back into like higher level activity. If you have access to a couple pieces of tubing, you can tie them somewhere, and then in order to train yourself with closed kinetic activity, which is a little bit more related to agility that you would have in sports, you could do something like go side to side with the tubing. And then some backwards movement. If you can get through this without any pain, then you're probably ready to return to activity. I'll just have Christopher demonstrate it for you. And that puts a lot of pressure on the hip. So if your hip's not ready to go, you'll know it when you do this type of exercise.
Thanks for watching, guys. If you have any questions or comments, leave them down below, and I will see you guys in the next one.